Order, order. Jim Shannon to move the motion.
Madam Chair, I beg to move that this House is considered rare autoimmune rheumatic diseases. It's a pleasure, first of all, to serve under your chairship. I've done it many times, and it's always a pleasure to be here and to see you much in control. Also a pleasure to see the Minister in this place. I was hoping this morning it would be the Minister. It was. Walked through the door, very pleased. Pleased to see any Minister, by the way, but especially pleased to see the Minister in person, so I don't offend anybody. I don't want to do that either. The Shadow Minister's in his place as well, and he and I talked last night about this. This debate, by its very nature, Madam Chair, is what I would call a niche debate. Because and if you have a constituent who has autoimmune rheumatic disease, or you know somebody who has, then you will be here to represent your constituents. But not everybody has, because there are only a small number of people across the Kingdom of Great Britain and Northern Ireland who have it. But I do look forward very much, and I was just chatting to the Democrat spokesperson there just before, and an honourable lady was telling me that, and she'll refer to this herself when the time comes, of the importance of her constituent, a good friend. I'll leave that to the honourable lady to put forward that case. I think I've always had an interest. I'm the party's health spokesperson, of course, Madam Chair. I have a deep interest in any health issues. I would say, of course, if there's any health debates anywhere in Westminster Hall or indeed in the Chamber, I make it my business to attend those debates, to contribute to them, whether by speeches or by questions. It's really important. I have an interest particularly in rare diseases, and that came through a constituent who lives down the Ards Peninsula, and he, I've known him probably all of his life. I think when you get to my age, there's many people you've known all their lives. That's just the fact of it. But the point is, he married a young girl from the area. She had a rare disease, and that interest and contact between her and I and the family across the Ards Peninsula, and across Strangford, became a massive issue. And that lady today and that family today, they fly the flag for rare diseases in the Ards Peninsula and in Strangford. I also want to thank the Backbench Business Committee for granting this debate. I say this, I think we start from the NHS point of view. I'm an advocate for the NHS, always have been, always will be, as we all are in this House. I am one who believes in the foundation of our NHS and the people who hold it together, the people who we may not meet, but who are the glue and the gel that keeps it going and keeps it together. I'm aware of the stress and strain on the NHS and give my full support as government attempts to make the changes that are necessary for the NHS to survive. Very much welcome government's commitment. I think it's £26.3 billion the government have committed to the NHS. That's a massive contribution and a confidence, I would believe, from the government in relation to that, and we welcome that. The starting position that I go from is praise for the people behind those three little letters, the NHS. And as we begin to look at the NHS restructure, and the Minister, Secretary of State, has confirmed that. The Ministers are all committed to it, and there's lots of priorities which government have to get, but part of that is the restructuring of it as well. It's a vital component of this that the NHS provides high quality and equitable care for all people, regardless of how rare or complex their condition is. And because you don't have, when I say you, I don't mean you, Madam Chair, I will say you, I mean me, or anybody else across the United Kingdom, maybe don't have a rare disease, they may not understand what it means to have one and how rare or how complex their condition is. But it does tell me that we need to be aware of it, we need to reach out, we need to help, and government has a commitment to rare diseases as well. And while they may not be mathematically or statistically numerous, they do represent individuals, they do represent families, relatives and friends who all understand it very, very well. In the last, before I come here, Madam Deputy Speaker, I was in the Northern Ireland Assembly. I was interested in and rare diseases then, and we got in contact with ladies again down the Ards Peninsula who were very much aware of rare diseases and issues. So we started that rare diseases group back in the Assembly, and we've continued it here over the years. So I wanted to add my opportunity to speak in their behalf on this very complex and rare disease, the autoimmune rheumatic disease. Happy to, yes, absolutely.
Thank the honourable member for giving away and congratulate him on securing the debate. Would he agree with me that just because of the fact that we are talking about rare diseases and the smaller number of people that impacts upon, that raising awareness amongst health professionals is a key aspect of trying to help people who may very often feel overlooked simply because of the very small number that come under the remit of the subject matter that we're discussing today?
Yeah, my honourable friend and colleague Atty often does in these debates. He always brings forward reminders of why this debate is important, why we need to raise awareness, and it's also to give confidence to those people out there who may have these diseases and may think that they're fighting this battle all on their own. Well, actually they're not. We need to raise awareness as well within staff, NHS staff. It's impossible to know about every rare disease, but it's good to recognise the symptoms and to be able to then point them in the right direction. The autoimmune rheumatic diseases are a range of chronic, currently incurable conditions in which the body's immune system damages its own tissues, often in multiple organs throughout the body simultaneously. Now, that's a lot of words, but it means it's coming at you from all sides, to use something we would say back home. This can lead to tissue or organ damage, and in some cases can be fatal. And it can't be ignored, the fact that it's fatal, and the importance that we respond in a positive fashion. At present, the outcomes are not good enough for people living with autoimmune rheumatic diseases. They wait too long for diagnosis, have variable access to specialist care, and can't always access help and support when they need it. So we do often say about any debate we have about in health, early diagnosis is important, but also having access to specialist care. If they notice something that's maybe unusual, not something they see every day, that the NHS workers are able to do that, and then that the care and the help and support that they need is available for them when they need it. Preliminary data from rare autoimmune rheumatic diseases, soon to be released, 2024 patient survey, found that the average time to diagnose from symptom onset was 2.5 years, 2.5 years before anything happens. And those 2.5 years you suffer, you worry yourself sick, and you wonder, am I going to get out the other side? And that 30% of patients waited for 5 years for a diagnosis from symptom onset. The rare automotive rheumatic diseases impact around 170,000 people in the United Kingdom, Great Britain and Northern Ireland. And some of these diseases, you may not recognise them, but these are some of the things that they have. It's Behçet's disease, it's lupus, it's myositis, it's scleroderma, Jorgen's syndrome and vasculitis. They can affect many parts of the body. It can be your joints, your skin, your lungs, your kidneys, your heart, and often require cross-medical expertise. Again, that's just a small number of some of those things that come the way of 170,000 people across the United Kingdom. Unlike the vast majority of rare diseases, these conditions predominantly occur in adult life and are predominantly non-genetic. So that means that you don't need to have a history of it. It can come out of the blue. And the Rare Autoimmune Rheumatic Disease Alliance, a group made up of clinicians and charities, for example, Lupus UK, Vasculitis UK, Scleroderma and Raynaud's UK, and Sjögren's UK, have set out a number of key solutions to improve care for RARES. They include strengthening existing specialised networks, setting out what good care looks like through a rare disease quality standard. They have also stressed that it is vital that rare disease isn't forgotten in upcoming policies such as the NHS's 10-year plan. I'm going to refer to that later on, because I think it's really important within the 10-year plan that we can give and I say we, I mean government and the Minister today, can give hope for those people who suffer from these diseases, and I don't think they're on their own, and the evidence-based response from the Minister will give them that assurance, which is really important, and that the progress made to date by the UK Rare Diseases Framework is built on. So that's my first question in relation to within the NHS's 10-year plan, that the Rare Diseases Framework is part of that. I want to share one example, if I can, Madam Chair, and that's someone who has had the personal impact of rare autoimmune rheumatic disease that has been highlighted to me. Zoe, Z-O-I, Zoe. She lives with a life-threatening rare GPA vasculitis. Describes herself, in her words, as lucky because she had a relatively short journey diagnosis. And I suppose for her, when she looks at others, will say, well, I am lucky. But I would like everybody who suffers from these diseases to have the same luck, if luck's the way, to use her words. And I don't believe in luck. I think everything's predestined. That's my opinion, personal opinion, by the way. But I said how we make it better. But this was only because her GP recognised her symptoms and knew to refer her right away. Now, does every doctor have that knowledge? I hope they have, but they may not have the personal observation. But this doctor did, and very quickly referred wee Zoe to. But the difference with this doctor, of course, he had a friend who died of the disease, so right away he knew what to look out for, and those were red lighted or red carded, despite her positive experience of diagnosis. Her experience of care since has been variable. So that's the second stage of where we are. When we diagnose what the disease is, then that's how the care system works as well out. She's faced long waits for appointments, poor communication between teams responsible for her care. In one instance, she received a letter from a consultant 4 months after an appointment. My goodness me. Now, was that the Royal Mail's fault or whatever it was? I don't know. But the problem was, it wasn't her fault that she didn't know about the appointment until it was too late. But it means that she had unnecessarily been taking a particular medication for months longer than needed. So it's the early diagnosis, it's the treatment that goes forward, and it's to have the speed and urgency in that process to make it happen. Zoe works for a charity supporting other people living with vasculitis, and describes it as heartbreaking that hers is one of the best diagnostic journeys you will hear of. Now, that's a lady who has it. She has been diagnosed. She's went through the process of the NHS to get out the other side and try to be better. But hers, in her words, is one of the best diagnostic journeys that you will hear of. So how do we improve the rest of it? The question in this chamber, how do we improve care? Speedy diagnosis should not be down, in Zoe's words, luck, and people like Zoe living with serious rare diseases should be able to access vital care when they need it. So that's why I'm calling on the Minister to consider the following recommendations advocated by rare autoimmune rheumatic diseases, because it's really, really important that we're aware of what the issues are. Firstly, ensuring that rare diseases are a focus of the 10-year plan for the NHS. First question again, I'm always pleased to see the Minister's place, and I mean that genuinely. It's not telling give the Minister a big head, but he does come back with an understanding, which I think we all greatly appreciate in this. I know I do, and I'm pretty sure that everybody else does as well. So when we look to this, will there be a focus in the 10-year plan for rare diseases? I'm pretty sure the answer will be yes, but I think we need the confirmation of that on Hansard today, and we need to reassure all of our constituents out there who are struggling with this disease and are unsure of just what the future means for them. The UK Rare Diseases Framework 2021, just 3 years ago, has been a significant step forward in securing equity of treatment for rare diseases, and I welcome that. But sometimes the system doesn't perhaps maybe just work as well as it should, and going forward I believe it is crucial that the government does not lose sight of the work done to date to drive change for people living with rare conditions. There's been good work done. I always like to, Madam Chair, to recognise good work. It's important that we give encouragement to those who are working hard, and maybe sometimes just think, we're playing away here and what are we getting for it? There's many of us, all in this room, for instance, as an example, we appreciate what our NHS does, and that good work that has happened for those with rare conditions needs to continue with the same zest, the same enthusiasm, the same fervour as perhaps it did in the past. So specifically, it is important that the NHS 10-year health plan working groups consider how improvements in rare disease care will be championed in the plan. In addition, it's important for the 10-year plan to consider how the work plan of the UK Rare Diseases Framework will be continued past the framework's end point in 2026. Again, second quest if I can, Madam Deputy Chair, or Madam Chair I should say, in relation to the continuation beyond 2026. I'm quite sure that within the 10-year plan that government are committing themselves, but I think I need to personally reassure my constituents in relation to this, but also I think we need to reassure the nation. We need to reassure those 170,000 individuals, and they're having 170,000 families and friends on top of that. The framework has been an important tool in coordinating methods to improve care for rare diseases, not just within England, and I understand that health is a devolved matter, but whatever happens here, I say this is how it works, Madam Chair, whatever happens here health-wise, it's the next stage for us back in Northern Ireland through the Health Minister. And I was talking to another minister on the tube coming here, Health Minister as well, and we were just saying how important it is that coordination happens across all four regions, and it's good to be able to push it from here and then to receive it back home. The framework has been an important tool in coordinating methods to improve care for rare diseases, not just within England, but across the United Kingdom of Great Britain and Northern Ireland. Numbers of people within Northern Ireland, for example, suffering may seem small numerically because we're a nation of 1.9, or a region, sorry, of 1.9 million. So therefore, the numbers will be small, but the impact is huge. Whilst overtly aware that the health is a devolved matter, I'm also aware that the standard can and should be UK-wide. The Minister always gives myself that reassurance, and those from other parts of this great United Kingdom, that coordination between here and the Northern Ireland Assembly, the Health Minister Mike Nesbitt, how I know the Minister has met, and I'm quite sure he'll meet with the Minister in the foreseeable future as well. So how do we develop a standard of care? NICE quality standards consist of defined, measurable statements that can be audited to reduce variations in case across the country. A rare disease quality standard would help incentivise an increased focus on delivering high quality care and treatment for rare conditions within the NHS, including the rare autoimmune rheumatic disease. So that's my third ask, developing the standard of care. That we need to have a quality standard that helps incentivise all the regions, all the parts of England, all the parts of Scotland, Wales and Northern Ireland, and to do it collectively better together. Work in this area is already well underway. The rare autoimmune rheumatic diseases have been working hard with organisations across the rare disease community to understand what good care looks like for people living with rare disease and how this should be reflected within quality statements. The association, has the Minister, for instance, had the opportunity to talk to the Alliance, to the association of groups that have come together? And I'm sure he has. I'm sure the Minister has. I don't doubt that for a second. But it would be good to have that liaison, and it helps when their ideas and the Minister's ideas and government's ideas become one. It's also important that the current work to develop quality statements is built on in a timely way, with swift development of a NICE rare disease quality standard. So that's my third request. Something that is also clear is we need a development of IT capacity in the fight for diagnosis, and that would be my fourth one, to ensure more people can experience the quick diagnosis like Zoe did. We need to increase funding for research in the diagnostic journey for rare autoimmune rheumatic disease to aid the development of diagnostic technology. And on research and development, really important that we're looking for the next stage, how we do that. Just to sidestep slightly, Madam Chair, in the paper today, one of the papers, I think it was I think it may have been the Express, were saying we should do something, government should be doing something to look at dementia as the dementia numbers arise. This is a rare disease, so it be well down the calling list for government. But it's really important that early diagnosis happens, and the research and development and the capacity to find a cure, to lessen the pain, to lengthen the time that people have in this world is really important. So again, Minister, on research and development, any help and indication of what's happened there would be incredibly appreciated. This investment would help to identify blockers to rapid diagnosis, as well as support the development of digital tools for faster and more accurate diagnosis. One of my colleagues, the Honourable Member for North Antrim, in a question to the Secretary of State in the Chamber some months ago, when it came out about my mind's went blank now, the report and the way forward for the NHS, and he had mentioned about having the digital tools for data. Now, government and the Minister in particular, Secretary of State, replied very positively. So government, I think, are looking at that. But it's really important that we have the digital tools in place, so that the data and more accuracy can come into play, and thereby help speed up the process, Madam Chair, in relation to ensure that we can find a better way forward. And because of the very rare nature of the rare autoimmune rheumatic disease conditions, it is not realistic that every hospital will have clinicians with expert knowledge of them. I understand that. Not everybody has knowledge of everything. They might have a small portion of knowledge, but this takes expert knowledge. So we need to have another way of doing that. The 2024 survey found that 29% of respondents were not very or not at all confident that the specialist healthcare professionals providing their care understood their condition. So how do we improve that? I understand we're in financially stringent times. They're difficult. Government has committed a large portion of money, as they should have, and I support entirely, to the NHS and to the health service. But we need to improve that. Again, that would be my fifth ask of the Minister, how we can do better. If only 29% of respondents are confident or not at all confident, then we do need to improve that. Can this, and I believe it can, this can be addressed through the development of specialised networks for rare autoimmune rheumatic conditions. That's the solution, in my opinion. I'll be interested to hear what the Minister's thoughts on these are as well. And these networks allow health professionals to access the knowledge and the expertise of tertiary and specialist professionals, whilst also developing capability and capacity for more care and treatment to be carried out locally that would otherwise be the case. That's I feel, Madam Chair, the answer to the fifth question. Again, I'll be very, very pleased to get the Minister's thoughts in relation to that. These networks are already in existence, an excellent example being the Eastern Network for Rare Autoimmune Disease, established in 2016. We've got a system in place. Look at it. Say it respectively when I say that. I don't mean in any judgmental way. Look at what they're doing and improving that. This network was formed to maximise the access of patients to relevant expertise while keeping their care as close to home as possible. This has been achieved by setting up excellent communication and a cascade of training between the specialised centres and the local trusts, while the specialised centres, local trusts, coordination, digital data, communication, contact, done in a much better way. This network lead has also calculated that its creation has saved, and here's the financial equation in this, because if it saves money, then it's got to be a system that has to be considered. The network lead has calculated that its creation has saved the NHS money. It runs at a cost of some £70,000 to £100,000, but it's generated an estimated annual saving between £150,000 and £200,000. So what we're saying in this is that £1 spent saves £2 in the NHS. Over a 7-year period, the reductions in inappropriate high-cost drug use. In other words, it's how the response by NHS to the patient takes place. The Sixth one is the challenge at present is that networks across the country like NRAD are run on the goodwill of clinicians. That's not sustainable. It never can be. I would ask respectively of the Minister, perhaps he would look at the NRAD scheme that's there, that's run by goodwill of clinicians, that has done very effectively in how it responds and how it can be better helped to, if it saves money, if every pound of NHS it saves £2, then the financial equation is clear. It's one that should be pursued across all of this great United Kingdom of Great Britain and Northern Ireland. To address this, government must provide the necessary financial support for them to be developed and maintained. This funding would enable vital posts such as a meeting coordinators to be created and clinicians to be reimbursed for their time. Again, I feel that would be the incentive. Goodwill is good to have, and there's much of it across this great nation. But at the same time, there may be better ways of doing things. This would ensure that benefits for patients and the NHS's budget could be realised across the country. So this 25.3 billion, I think the figure is, the Minister will correct me if I'm wrong on that, that's committed to the NHS. That shows that here's another way of bringing more money in, of saving money in the NHS, and it's really something that should be done. My last request, Madam Chair, is this. Specialist nurses can play a crucial role in supporting people living with the rare autoimmune rheumatic diseases. The preliminary results from the 2024 survey show that respondents with access to a specialist nurse were more likely to report that they had access to enough information and support about their condition compared to those who did not have an access at all to a specialist nurse. But less than 3 in 10 respondents, some 28%, had access to information from a specialist nurse, and this varied widely by condition group. So the role of specialist nurses, wow, how important that is, and I would be reassured by the Minister if he can come back to me in relation to their role, the role they quite perhaps exclusively play, a very important, vitally critical, important role that they play. And if we only have 28% of people who have access to information from a specialist nurse, when it should be more, then what can be done to do that? I conclude with this, Madam Chair. So finally, I would ask the Minister, when developing the NHS's workforce plans, to consider what more can be done to recruit more specialist nurses to support people with the rare autoimmune rheumatic disease. We must always, I believe, consider the fact that whilst the chances may be 1 in 10,000 for a rare disease, the reality is that the patient deserves all of the help from diagnosing to treating and supporting that we can offer. And I would ask the Minister, very kindly, very, very sincerely and very humbly, to clarify that this is the goal of this government. I believe it is, but it's not about me today, Madam Chair. It's about the people that we represent in this House collectively together across this great nation. I believe we have a role to play, a very important role. I believe the Rare Autoimmune Rheumatic Disease Alliance has, with all the clinicians and with all the charities, has brought together some ideas which I think are positive, and they can help us together. It's not about blame. This is never, ever, ever about blame. It's about how we do it better. And I think on behalf of my constituents who have contacted me and others who will speak shortly, and for the shadow ministers and for the Minister, in conclusion, we put forward our case and we look forward for support from government. Thank you so much.
The question is that this House has considered rare autoimmune diseases. Can I remind members they should bob if they want to be called in the debate? In that case, Peter Dowd.
Thank you. Thank you, Madam Chair, and it's a pleasure to see you in the chair. I wanted to, first of all, thank the Honourable Gentleman for bringing this issue before us today, because it's one of those subjects that doesn't get the attention that it actually needs. And so it's really important, Madam Chair, that we do tease some of these issues out, because there's a danger that they could be forgotten if we don't. So it's, and I know the Honourable Gentleman pushes this matter time and time again. I think it needs to also be set in the context of the whole question of rare autoimmune rheumatic disease. It needs to be set in the context of the wider issue in relation to rare diseases. Rare diseases affect 1 in 2,000 people. There are 7,000 rare diseases affecting 1 in 17 people. That's 3.5 million people. And of course, they can be of a genetic or a non-genetic origin, and of course affects adults and children. And in relation to rare diseases, 75% affect children, and more than 30% of children with a rare disease die before their 5th birthday. Now, I think that's a sobering statistic. So I think we have to get it into that context, that this impacts upon the lives of so many people, not just those people who are directly affected by the particular disease, but their family members, their friends, the impact it can have on people's work-life balance, the impact it can have on their job, the impact it has on them more broadly. And of course, there are challenges out there, and I'd like to thank the Rare Autoimmune Rheumatic Disease Association and the Alliance, rather, for bringing those groups together to push for this. They believe that getting together, as we all do, gives you more strength, and I support that, and I know the Minister would no doubt support that, basically. So what we don't want is rare diseases, and this particular one, to be left at the back of the queue, and I know that the government acknowledge that as well. So it's not a finger-pointing exercise, nor is it a finger-pointing exercise in relation to health professionals. I mean, many people with this disease say that they don't get the support that they need. They're not blaming individual clinicians, they're not blaming individual practitioners or individual healthcare workers. I think they're, I suppose, blaming the system insofar as it doesn't bring those professionals together in the clinical networks, for example, that the Honourable Gentleman referred to. So again, it's not a finger-pointing exercise, it's just trying to say where we are able and have identified problems in the system, it's our responsibility to try to fix those problems, and that is really, really important. So I think the Honourable Gentleman touched on this as well, the issue about needing defined, measurable and identify standards to reduce inequalities in provision of health care. And I know that the Alliance is working with others to set out key statements that they believe will form the quality standards for the future. And they have set out challenges, the challenge of focusing on this particular issue. The points that the Honourable Gentleman raised about from symptoms to diagnosis can be as much as 5 years, 2.5 up to 5 years, and potentially beyond. The challenge that we have in relation to access to specialist knowledge and expertise, and the point the Honourable Gentleman made very validly about the need, and I repeat, for those specialist networks, essentially. And of course, the challenge of getting the support out there to the people, to the professionals actually dealing with our constituents in one fashion or another. Now, I know the UK rare disease plan, and in this my case, England's rare disease plan, has been trying to help patients to get a diagnosis faster, but we need to do more in regards to that. They have been pushing to raise awareness amongst professionals, but we need to do more in relation to that. Better coordination of care, improving access to specialist care, treatment and drugs. And of course, focusing on the needs of the various nations. Although they're all much similar in terms of the problems they face, I believe that focus at that national and potentially regional level is also very important. So I just wanted to come here to support the Honourable Gentleman today, because he's made really very important points. We will no doubt come back to this, and I know the Minister will respond, as he always does, in the most constructive and positive fashion, and I look forward to hearing what he has to say and other members from the other parties. And I'll just finish on this particular note for the Honourable Gentleman. At no point during that issue, any of those issues that I raised there, did I mention either Shakespeare or Sophocles. Thank you very much, Madam Chair.
The first of our three front benchers for the Lib Dems, Alison Bennett.
Thank you, and it's a pleasure to serve under your chairmanship, Dr HoC. Firstly, I'd like to thank the Honourable Member for Strangford for bringing forward this debate on a subject that all too often doesn't get enough attention, but it is really important and does affect millions of people in the country. So thank you. And I'd also like to thank the Honourable Member for Bootle for his contributions. As we know, there are over 160,000 people in the UK living with rare autoimmune rheumatic diseases. And identifying and treating and caring for those people is complex. Yesterday, my constituent Carrie from Mid-Sussex told me about her experience. She suffers from a number of conditions and has done since she was diagnosed 30 years ago. Interestingly, for somebody who's been carrying these conditions for 30 years, she considers herself fortunate to being diagnosed with Raynaud's and lupus at a young age, because it allowed her to start treatment early and receive consistent care. She knows from experience that early diagnosis and treatment makes the real difference. And this is a point that honourable members have already made today. And while Carrie believes she's been lucky and received good care, she stressed that for many people, they face years of misdiagnosis or dismissal and poor and almost non-existent care. These failures only exacerbate their symptoms further down the line. And sadly, one of those less fortunate than Carrie is her own mother. So her mother doesn't live in Sussex, she lives in Yorkshire, and her mother too has multiple autoimmune conditions. But contrastingly, she has always been made to feel like a hypochondriac, not an unusual experience for those seeking help with rare autoimmune rheumatic diseases. Carrie's mother was eventually diagnosed late and after many unnecessary years of suffering. She suffered for longer and had to a greater degree simply because no one believed her or was able to diagnose her. Carrie told me that a postcode lottery exists in the quality of care for those with these conditions. And it really is down to the specific medics and practitioners an individual meets as to how well their condition is identified and treatment can begin. Carrie's Raynaud's is particularly debilitating during the winter. She told me that more awareness of the issues around these conditions and how symptoms can be alleviated is vital. Often, solutions can be as simple as helping with buying things like thermal gloves or socks. Another major challenge has been the impact of her autoimmune conditions on her teeth, particularly with the Sjogren's that she suffers from. Carrie has spent thousands and thousands of pounds on private dental care over the years. And this has been the only option available to her. NHS treatment wasn't available. And despite that money that she's spent, Carrie now thinks it's not long until she has very, very few teeth left. She thinks that the current system is disjointed, with her dentist not understanding the issues surrounding her conditions, and her rheumatologist, likewise, not understanding the impact on her dental health that the condition she has have upon her. Carrie believes that a more coordinated, multidisciplinary approach to treating these conditions would help. And it's clear from my conversation with Carrie that we simply must do better on this. We must tackle the postcode lottery exemplified between Carrie and her mother at opposite ends of the country, build a more joined-up system, and take rare autoimmune rheumatic diseases seriously so that we can start diagnosing earlier and on a consistent basis. And while the problems seem daunting, I believe that with a collaborative approach and by working with organisations like the Rare Autoimmune Rheumatic Disease Alliance, we can find solutions to the problems that Carrie has told me about. It is already Liberal Democrat policy to ensure everyone with long-term health conditions has access to a named GP. And we also must do better on dentistry, both generally in terms of sorting out the NHS contract, making sure we have a proper workforce plan for dentistry, and then also in the specifics of people with these rare diseases that have a massive impact on dental health. And as well as having access to a named GP, I and my Liberal Democrat colleagues are campaigning for the medicines and healthcare and products regulatory agencies to have greater capacity. This would help speed up the process by which new treatments reach patients, a potential game changer for those suffering with these conditions. We need change if we're going to help those living with these complex, long-term and truly debilitating conditions. And while the diseases themselves may be complex, I believe the solutions need not be. I'm encouraged by the words of honourable members today, and together we can effect the change that Carrie and her mother and so many others need and deserve. Thank you.
His loyal opposition, Shadow Minister Dr Luke Evans.
Thank you, Chair, and it's a pleasure to serve under your leadership today, and thank you for the introduction as well. And can I thank the member for Strangford for his detailed canter through something that is needed to be highlighted, and particularly a spotlight drawn upon. And particularly, I think he's hit the nail on the head with improving clinical pathways. And we, as a House, need to think about the best way to do that, to help the NHS to do that. And he exemplified that by telling Zoe's story, which I think the member for Bootle rightly highlighted, the impact on patients, and that's the key crux of the matter here. And it was personified by the member for Mid Sussex with her story about Carrie, what Carrie and her mother have to go through, literally the living difficulties they're breathing every single day. And that coordination of care is so important. Now, the member for East Londonderry has left now, but his intervention was quite timely and pointed as well as about clinicians and awareness and training. And being a clinician, bringing that experience to the House, it is quite difficult to identify these issues. They are often masked by other conditions, and even with some of the tests that you can do, a random screening test will include rheumatoid factor, anti-CCP, antibodies, ESR, CLP, ANA, ANCA, and even things like anti-LO and anti-RA. But all of these may be positive or negative, and it can be indicative but not definitive of some of the conditions. And that's part of the problem we have with these rare diseases. And with 170,000 people, it means they are uncommon, but common enough for you to see them. And I certainly have treated several patients who've had things like SLE or Sjogren's or Raynaud's. And I think when we think about these things, we need to break them into two distinct groups: the connective tissue disorders, which includes lupus, scleroderma, myositis and Sjogren's, but also vasculitises, things like ANCA-associated vasculitis, giant cell arteritis and Behçet's. And by their very nature, because they are rare, they are hard to diagnose. And I'm hopeful that in the future, we may well have the likes of AI to help clinicians be able to identify or at least think about the differential diagnosis when it comes to dealing with these patients. It's a broad and difficult topic to break down, so I thought it might be helpful to take an approach of looking at both the framework to address rare diseases, the research behind it, the diagnosis and the workforce, and finally the treatment. So I'll take those all in turn. If we look at how to break this down, a framework to help the approach is really important. And under the previous government in 2021, the UK Rare Disease Framework was published to set out a vision to improve the care for people with rare diseases. And it had 4 priorities: delivering early diagnosis, increasing awareness amongst health professionals, improving access to a specialist team, and providing coordinated care. In essence, the care pathway. And this framework was designed to improve the speed of diagnosis, the coordination, and the access. In the words of the Rare Autoimmune Rheumatological Disease Alliance, the UK Rare Disease Framework has been a significant step in securing equity for treatment for rare diseases, and going forward, it's crucial that the government does not lose sight of the work done to date to drive changes for people living with rare conditions. So therefore, I'd ask the Minister my first question: how his government intends to build on the rare diseases framework, ensuring it remains adequately funded and relevant. Now, next we need the research, and this is the hardest part. As I pointed to, some of even the tests can't even diagnose things like Behçet's syndrome. It's often a clinical diagnosis. So the establishment of the Genomics England project, further mapping the genetic codes of individuals with rare conditions, was a move held by researchers worldwide. The programme, though ostensibly broad, directly benefits patients of rare autonomic autoimmune rheumatic diseases by identifying genetic markers and enabling targeted treatments. So my second question to the Minister is, what progress has been made in expanding genetic research to uncover new treatment options for these kind of diseases? Earlier this year, the government published an action plan that would include significant new commitments against each of those 4 framework priorities, including the health inequalities that we've heard so expertly talked about today. The action plan highlighted the significant investment made in driving research for the diseases, including a £14 million investment to the UK Rare Disease Research Platform. This facilitates greater collaboration between academics, clinical and industry research, as well as people living with rare diseases, research charities and other stakeholders to try and accelerate the understanding and the diagnosis and therapy of these diseases. So I was pleased to stand on a manifesto committed to take forward the Rare Disease Action Plan. Now, I fully accept there's more needed to be done, and the new government must work closely with its delivery partners on this. And in a recent written response, I was pleased to see that the government reiterate its support for research into rare diseases. It further highlighted the Department for Health and Social Care has invested £2.2 million for the National Institute of Health and Care Research to carry out research programmes related to rare genetic diseases. And, of course, the £340 million to Genomics England. Now, in my medical training, actually, I come from the University of Birmingham Medical School, and they actually have a University of Birmingham Centre for Rare Diseases, an exact collaboration to try and pull together all the academic research. And that translational research, because as we pointed out, as we keep saying, these are rare, so by definition to do the trials, you need to have a wide pool to pull people together to try to work things out. So I hope the member for Strangford will take some interest that actually they've joined up with the Belfast Queen's University to be able to research and collaborate across the 4 nations, including Newcastle University. And I remember back in 2015, I had the privilege of going to visit that centre as well. So it's a note for himself to look into that. Therefore, will the government continue to be increasing funding specifically for rare autoimmune rheumatic diseases, especially within the Medical Research Council's Care for Rare Disease programme? Then we need to look at the workforce and testing capacity. And over the last few years, the government has allocated £2.3 billion into community diagnostic centres. We know there are almost 170 across the country. These are really, really important for doing blood tests, ultrasounds, MRI scans, CT scans. And in my own constituency, I'm lucky enough to have £24 million invested. One is being built as we speak. And this is revolutionary for our area because for too long, people had to travel to the likes of George Eliot or into Leicester. Now they can have these kind of tests right here in their community, which is swifter access, which will hopefully help the likes of Zoe that we heard, making sure that she's one of the lucky ones getting swift access. But within that, we also then need to be able to have the people to be able to do the tests and understand the specialisms. So could I ask the government, the Minister will tell us, will they be expanding the network of CDCs any further? And regarding staffing, the last government brought forward the NHS workforce plan. How is the government looking at addressing both rheumatology and radiology in that plan to make sure there are no gaps? And finally, of course, we have treatment. That's the one thing we're looking for. We've got that diagnosis. We need that treatment. So innovative drugs are coming, the likes of immunotherapies, but they often come with high price tags. And so with NICE looking at how to speed these things up, but would the government commit to ensuring that these processes are accelerated so that we can actually make sure people get these drugs, the innovative drugs, as quickly as possible? But we shouldn't forget there are standard drugs that are used as well, the likes of things like methotrexate. Now, they can be quite dangerous drugs, so I'd ask the government what they're doing to ensure there's safe usage of these kind of drugs, because disease-modifying medications are really important. They can have high toxicity if not used properly and can therefore cause harm, so safety is really important. So in concluding, the legacy of the previous government is one of framework established, investment being made, and a road to improve lives. For the 2024 general election, the Rare Autoimmune Rheumatic Disease Alliance published a manifesto which called on the government to ensure that rare diseases remain a priority, develop a quality standard for rare diseases, and develop a better support for specialist networks. So how will the government work to consider and address these points. And overall, I hope this debate has highlighted exactly those calls, because we're unanimously agreed this is what we need: research, networks, support and treatments for these individuals who are suffering.
And finally, for His Majesty's Government, Minister Andrew Gwynn.
Thank you very much, Dr HoC, and it's a pleasure to serve under your chairmanship. I would like to start by thanking the Honourable Member for Strangford. I want to call him an honourable friend because he is a friend, but convention dictates I must call him an honourable member. But I really welcome the fact that he cares so much about these issues and lots of issues relating to health. I now see the honourable gentleman more than I see my wife. Because he's always in these debates when it comes to a whole range of health conditions, and he brings so much passion to these debates. I think it's been really important that he has highlighted the issue of rare diseases. But also, I want to thank him for the way he's put his case to the House this morning and how he's put Zoe's experience, because when we humanise it, it makes it all the more impactful. I'd also like to thank my honourable friend, the member for Bootle, for his contribution, and indeed the honourable lady who leads for the Liberal Democrats, because again, she's humanised this with Carrie's story, and that is crucial. And then lastly, the Shadow Minister, who brings his professional experience to this debate. And that cannot be underestimated either, because, you know, Dr HoC, I'm not a medical professional, I will confess that, but actually it is important when it comes to health debates that we listen to the expertise that work on the front line, that work in the sector, and I thank the Shadow Minister genuinely for the way that he's approached this debate. This isn't a party political knockabout debate, this is something that I believe we all want to see progress on. And that's the beauty of Westminster Hall. We can leave the knockabout to the main chamber, but in this room we can really get into the detail of some really important subjects that often get overlooked, but that are really important. And then lastly, Dr HoC, I would also like to pay tribute to those affected by rare disease and their families, including rare autoimmune rheumatic diseases. The work of patient organisations such as RADAR even, the Rare Autoimmune Rheumatic Disease Alliance, in raising awareness and campaigning to improve the lives of people living with rare diseases is vital. And I thank those who dedicate their lives to this community. While rare diseases are individually rare, they are collectively common. And that is a really important point to make. 1 in 17 people will be affected by a rare condition over their lifetime. And I know that people living with rare diseases can face additional challenges in accessing health and social care. Indeed, as the Honourable lady put it, a whole range of health services, including dentistry, and that's something that I hope my honourable friend, the Minister responsible for dentistry, will pick up, and I will make sure that he receives the comments that she has put to the House in this, because often dentistry is something that is overlooked when it comes to people with rare conditions. But we are committed to improving the lives of people living with rare conditions. As the Honourable Member for Strangford mentions, the UK Rare Diseases Framework outlines 4 priorities to achieve this aim. These are helping patients get final diagnosis faster, increasing awareness of rare diseases amongst healthcare professionals, better coordination of care, and improving access to specialist care, treatments and drugs. Rare diseases are a priority for this government. In England, we have published a Rare Diseases Action Plan annually. These detail the specific steps that we are taking to meet the shared priorities of the framework. Each action has an owner, it has desired outcomes, and how we will measure and report on progress. This government is committed to delivering on the priorities framework, and we are working to publish the next England Action Plan in early 2025. Now, the UK Rare Diseases Framework comes to an end in 2026, and I know that the rare disease community would like to see a continuation of this policy to maintain the momentum and the progress made over the lifetime of the previous framework. The framework is UK-wide, and it is agreed across the devolved nations, and I would be more than happy to discuss further with colleagues in Wales, in Scotland, and for the Honourable Gentleman Mike Nesbitt, the Health Minister in Northern Ireland. I am the UK Health Minister with responsibility for engagement with the devolved administrations when it comes to health and social care. Indeed, we've got a meeting with them and the Secretary of State, I think tomorrow, to discuss a whole range of issues, and I am more than happy to discuss further with colleagues to see if we can, and I believe if we can, we should, maintain a four-nation coordination to this area. So I give the Honourable Gentleman my commitment that I will take this up with the devolved health ministers to see if we can continue the four-nation approach. In England, I am committed to working towards the four priorities of the framework, which were identified through the 2019 National Conversation on Rare Diseases. My department will undertake engagement next year alongside the evaluation of England's rare disease action plans that has been commissioned through NIHR to inform future policy decisions. The government is committed to providing the best diagnosis and care for rare diseases as set out in the UK Rare Diseases Framework. Good diagnosis should be timely and accurate, and I know currently people living with rare diseases often face years-long journeys, diagnostic odysseys before they receive an answer. Many health professionals are involved in a patient's journey, from specialist testing to genetic screening to your GP and primary care professionals, as indeed the Shadow Minister set out. And raising awareness of rare conditions amongst these professionals is one way in which we can help to speed up diagnosis. I know that every experience of living with a rare disease is unique, and with over 7,000 identified rare diseases, we focus on addressing shared challenges across all rare diseases. Whilst increasing use of genetic testing is a groundbreaking tool in diagnosis, many conditions, including rare rheumatic autoimmune diseases, do not have an identified genetic component. So it's important that overall awareness, diagnostics, and quality of care continues to serve all people living with rare conditions. NHS England are working to improve awareness of rare diseases in healthcare professionals, including in primary care, through the NHS England Genomics Education Programme, which includes non-genetic rare disease. The GP provides education and training to support the specialist and wider workforce to diagnose rare conditions early and to know how to deliver the best possible care for patients and families. Now, the Shadow Minister mentioned about this particular area, and working with partners such as Medics for Rare Disease, the GP has created genomic notes for clinicians, G-Notes, which is an innovative digital educational resource for healthcare professionals. The GP works to provide information to GPs where and when they need it, for example, presenting at primary care educational events, producing blended learning modules for GP trainees, and ensuring regular reviews of the Royal College of GPs curriculum. The Shadow Minister rightly mentioned research, and I want to reassure him that the Department of Health and Social Care, and it started on the previous government's watch, and we are rightly continuing that progress, supports research into rare diseases through the National Institute of Health and Care Research. The NIHR is the nation's largest funder of health and care research, and they welcome funding applications for research into any aspect of human health, including rare diseases. The usual practice of the NIHR is to, and other research funders, is not to ring-fence funds for expenditure on particular topics. Rather, the UK Rare Diseases Research Landscape report described an almost £630 million of investment from MRC and NIHR programmes in rare disease research over 5 years. We are now working with the rare diseases community to further understand the gaps and the priorities and to get them into those research pathways so that we can hopefully fill those gaps. Now, as many rare diseases are chronic and affect multiple body systems, those living with rare disease face complex condition management, and they interact with many specialists and providers of health and social care. This can include travelling across the country to access highly specialised care from experts. All of this can add up to a significant emotional and physical burden, and it deepens existing inequalities. So coordination of care is essential to ensure that that care is effectively managed, that the burden on patients and their carers is minimised, and that healthcare professionals are working together to provide the best possible joined up and high quality care. Last year, we hosted a workshop with RADAR, and that was to explore how best to support people living with non-genetic rare diseases. This highlighted the importance of specialised networks of care in delivering high-quality care at value for money. Networks, as we've heard from the Honourable Gentleman, the member for Strangford, like the Eastern Network for Rare Autoimmune Disease, are an example of best practice. And I would encourage ICBs to consider similar models across the whole of the country and for types of rare diseases. And I'm more than happy to look closely on how we can seek to spread that best practice across the country, across different rare disease types, across ICBs. Because patients with rare conditions deserve the same quality, the same safety and the same efficacy in medicines as other patients with more common conditions. NICE, the MHRA and NHS England are working to understand and to address challenges preventing treatments for rare conditions reaching patients who need them. And I take on board precisely the points that the Shadow Minister raises about the new drugs and how we get that faster access, how we create the environment whereby clinical trials are more readily available here in the United Kingdom. And I want to assure members across the House that this isn't just a central part of our health mission, it's a central part of the government's economic mission as well, because we want the United Kingdom to be a base for investment in life sciences, in medtech, in the access to the clinical trials, so that our patients win as well as our economy. We do have to ensure that safety is foremost in our deliberations. Safety is paramount, and we must ensure that in whatever regulatory regime that we have to encourage the life sciences, medtech and data industries into the UK, that safety is never ever compromised, and I take on board fully the comments made by the Shadow Minister. NICE has also been working with RADAR to create a quality standard for rare diseases. This will find commonalities across the more than 7,000 identified rare diseases to develop standards that will drive quality improvement across multiple rare disease groups. And while the majority of rare diseases are genetic, others, such as rare autoimmune rheumatic diseases, don't yet, as I've already said, have an identified genetic cause. A study by Genetic Alliance UK suggests that these conditions are often higher prevalence, impacting a significant number of people. And so it is important, Dr. HoC, that both genetic and non-genetic conditions are considered. Approximately 3.5 million people in the UK live with a rare condition, and addressing shared challenges across all conditions is going to be central to this government's approach. In addition, we know that shared challenges across the health and social care system are often exacerbated for people living with rare diseases, such as access to mental health support, something else that the Honourable Lady mentioned. And a central mission of this government is to build a health and care system fit for the future. The Honourable Gentleman, the member for Strangford, raised our 10-year health plan, and I want to reassure the House that this is intended to focus on the 3 shifts needed to deliver a modern NHS, not just fixing our NHS, but making it fit for the future, for the next 10, 20, 30 years, putting it on a modernised footing as well as fixing the fundamentals. And these 3 shifts are moving from hospital to community, analogue to digital, and sickness to prevention. And these shifts offer opportunities to improve time to diagnosis and care for people living with rare diseases. While many highly specialised services for rare diseases must be delivered in hospitals to ensure those high standards of expert care that we want to see, we can improve coordination of care to deliver better treatments closer to where people live, where possible. And while many rare diseases are not preventable, early diagnosis can lead to interventions that improve health outcomes. And on the Shadow Minister's point on community diagnostic centres, it is this government's commitment to continue with that programme. Indeed, I've seen the benefits myself. I got to open the new CDC at Crown Point in Denton, in my constituency, in July. And already that is having a game-changing impact on the local community, being able to get faster diagnosis, get people into treatments more quickly, and better outcomes and better patient experiences for those that access those facilities. The 10-year plan will ensure a better health service for everyone, regardless of condition or service area. On the 21st of October, we launched a national conversation on the future of the NHS, inviting views from across the country on how to deliver a health service fit for the future. Patients, staff and organisations can make themselves heard by logging on to the online portal, change.nhs.uk, and I'd encourage honourable members to do the same and to encourage their constituents to do the same, Dr. HoC, if they haven't done so already. But I know that there remains unmet need for people living with rare diseases, including rare rheumatic autoimmune conditions. I would like to reaffirm that I am deeply committed, as is this government, to working across the health and care system and with the rare disease community to address them. Finally, Dr. HoC, on workforce, the Honourable Gentleman and indeed other members asked if the goal of the government is to ensure that a patient gets the treatment, and we get that treatment with the workforce, and getting that right workforce is going to be the key. And I want to seek to reassure members that it is the goal of the government to ensure that the patient deserves all the help the NHS can offer in terms of treatment, care and support. The 10-year health plan will deliver those 3 big shifts on hospitals, community, analogue to digital, sickness to prevention. And to support delivery of the 10-year plan, the Secretary of State has confirmed we will refresh the NHS long-term workforce plan next summer. This will help to ensure that the NHS has the right people in the right places and the right skills to deliver the care patients need when they need it, not just today, but in the future. And the kind of shifts that we want to see in the delivery of healthcare will require rethinking the kind of workforce we need in 10 years' time. I will give way.
I'm very grateful in acknowledging workforce and looking at the workforce plan. I was aware of the Health Secretary's plan to relook at this. He's talked about it'll be done, I believe, in next year. Does he have a timescale on how long that review will take? Because the danger is, especially in healthcare, modernisation is happening so quickly, but by the time you reviewed something, actually it's out of date and needs another review. This is always a chicken and the egg moment. I'd be grateful if we have a timescale.
Yeah. So we will refresh it next summer, and we are already beginning to think in the Department of Health and Social Care, if this is what the shifts are intended to bring about, and these are the outcomes we want to see as a result of these shifts. And if we are, for example, having a neighbourhood health service that delivers much more in a community setting, how do we ensure that we have the right skills, the right workforce to deliver that? And particularly on the shift from analogue to digital, you know, we will need a lot more tech-savvy clinicians as well. So how do we build in some of the massive advances in AI, in medical devices and medical technology as part of that? We will be doing that concurrently with the 10-year plan to make sure that we have ready to go that workforce plan refresh, so that we can then start the process of ensuring that in the training and recruitment processes in the immediate future, we embed the future and not just today's practice. So, as I say, that refresh will begin next summer. But it is a chicken and egg situation. We need to work out what the future of the NHS is going to look like, and then obviously have to ensure that we have the skills to meet that ambition, not just for today, but for the future. In closing, Dr. HoC, I would again like to thank the honourable gentleman, my friend, the member for Strangford, for raising such an important matter, and to the rare diseases community for their continued and constructive engagement with government to help bring about meaningful change. I hope I've reassured him, both on cross-UK working, and I take up his challenge to try and get colleagues across the devolved administrations to agree to continue a UK-wide approach, but also with my specific responsibility here in England. We take forward the 4 areas identified in the UK plan. We will have a new plan for England, and we will seek to make the significant progress that I believe all members of this House want to see happen, and I'm more than happy to work collegiately with members across the House, both in terms of their role, Dr. HoC, in scrutinising the government, holding our feet to the coals, making sure we do what's in the plan at a speed and pace that is the best for the people who are living with these conditions. But also, I accept I am not the sole font of all wisdom in this area. I know the Shadow Minister is surprised by that. And genuinely, whatever people bring to the table, whether it's personal experience, whether it's professional experience, whether it's their stories about their constituents' experiences, we need to share that knowledge so that we can improve how we deliver the outcomes that we want to see improved for people living with rare diseases. And I stand willing and ready to work with honourable members from across the House and indeed with organisations that champion this area so that we get the best outcomes for the people who deserve that.
Jim Shannon to respond.
Chair, first of all, can I thank all of the honourable and right honourable members for their contributions, and refer first of all to the honourable member for Bootle. Always a pleasure to hear the honourable gentleman come along and make his contribution. Even when there's things that are said in other debates which we may feel a bit challenged with, he always delivers it in a lovely way. And not many people can do that, but today he delivered something exactly that we all agree with, so I thank him for that, and I mean that sincerely, but he knows that as well anyway. He referred to the effect upon families. He's right. Those who want to work and not able to, absolutely. And he said he didn't want to see it at the back of the queue, and he's right as well. So all those things are pertinent to the debate. To my honourable friend, member for East London Derry, he referred to awareness and training, and again a very salient intervention, and we thank him for that. The honourable lady for Mid Sussex, well, the minister's right. There's no better way of telling a story than telling it as an example. The honourable lady told of our good friend Carrie the effect upon her, the effect upon her mummy as well, and how sometimes they were wondering what it was all about. The condition worsens in winter. How the health service responds, and that's critically important. The honourable member, the Shadow Minister, brings his wealth of knowledge sincerely to any debate from his own personal experience and from his vocation as well. He referred to the two groups, those with tissue, those with vasculitis. They referred to the vision for the rare disease framework, new action plan. I'm really interested, didn't know about it by the way, and I thank the honourable member for that. They tie up between Birmingham, Newcastle and Queen's University in Belfast for research and development. I know Queen's University, some of the things they do, but I didn't know about that specifically, so thank them for that, and thanks for the wee reminder of how to get onto that as well. That's really been helpful. I think I'm encouraged today by what I've heard, and I also referred to research network and support and working collectively to make it better. Disease modification drugs need to be regulated, and that's a wee reminder of some of the things. It's not always straightforward, by the way, either. The Minister, this debate's never about me, it's never about any of us here, but it's always about our patients, it's always about our constituents, it's about those who we serve in this place. And today, I mean this honestly, I think the Minister had developed a very positive response. And for all of those out there, my constituents, the honourable lady's constituents, the honourable gentleman's constituents, they will all be encouraged because they've listened to this debate and they want to know what government's going to do, and the things the Minister referred to highlight the rare diseases, the personal stories, raise awareness, and rare diseases are rare, but they're collectively common. It's a very salient, very poignant comment. Measure and report and progress. He referred to the 2026 end of the framework, but the Minister gave us assurance, Madam Chair. He referred to a mission and contact the 4 nations so that they can approach it together and commitment together. And I think that's also an answer to one of the questions I asked, because that's what the Minister has committed himself to doing, and we should be reassured by that. Also, the good diagnosis should be timely and accurate. He referred to genotes and the digital improvements, and that's really important as well. And also referred to NICE to encourage research and development for rare diseases, because we've got to look forward to try and someday hopefully finding a solution. He also referred to NRAID as a good model for all to follow, and government will put this idea to the fore where there's been a good example. Also referred to, and he's right, by the way, Minister is absolutely right, economic and health commitment for clinical trials so that our own patients win each time. He also referred to the training and workforce, again encouraging comments in relation to that there. So early prevention, faster diagnosis, better outcome. I think those who have rare diseases, that 170,000 people across this great United Kingdom of Great Britain and Northern Ireland, and all those families, all those people will today be encouraged by the debate and the contributions that have come from all sides. But most importantly, if I can say this honestly, sincerely, to the Minister, thank you.
The question is that this House has considered rare autoimmune rheumatic diseases. As many as are of that opinion say aye. Aye. Of the contrary, no. I think the ayes have it. I think the ayes have it. Order. Sitting suspended until 11 o'clock.